This is COVID Conversations on Risk, a special edition of Let's Talk Risk with the Society for Risk Analysis, the world's leading authority on risk science and its application, in a podcast that helps bring clarity to the world of risk, uncertainty, and ambiguity. Well, welcome again to COVID Conversations on Risk. Today, I'm honored to be able to introduce and interview Vicki Bier from the University of Wisconsin. So, Vicki, maybe you could start by telling us a little bit of background about your previous research and how you approach risk analysis.
Sure. Most of my work historically has been really in engineering risk analysis, not in health-related topics. So, for example, I did a lot of work on probabilistic risk analysis for complex engineered systems, things like nuclear power plants or the space shuttle. And then after September 11th, 2001, I did a lot of work on protection of complex infrastructure systems for Homeland Security. So for some people who know my work, it might be surprising that I did much on pandemics. But 13 years ago, I had a small project on pandemic planning for the Wisconsin Department of Health with a few colleagues. And this was back when people were worried about a possible pandemic of avian influenza. And obviously, Wisconsin Department of Health didn't need our help with the medical and epidemiological aspects of avian flu. They were totally prepared on that side. But they definitely needed our help with systems thinking and actually also with risk communication. So part of the frustration that they had that led them to seek out working with us is that if they would talk to people from other agencies, for example, Department of Workforce Development, or talking with state legislators, Department of Health wanted to raise awareness about all the kind of multidisciplinary or multi-agency responses that would be needed in the event of a pandemic. And initially, when they first tried having those conversations, they got a lot of responses along the lines of, gee, that sounds like a public health problem. Aren't you guys responsible for public health? Why can't you just take care of it? So we were able to help a lot with the communication problems. For example, we created maps showing which counties would be hardest hit economically in the event of a pandemic, which would lose the largest numbers of jobs or largest amount of income for the county, so that they could then go to legislators, for example, from heavily tourism-dependent counties, and show very clearly how big the local impacts of a pandemic would be for constituents in those counties and get legislators' attention more easily. So we looked at pretty much all of the kinds of issues that are playing out right now, or many of them: school closure, business closure, the need for essential industries to remain operating, and also the needs of the working poor, the kinds of things you hear discussed these days as far as sick leave, unemployment, moratoriums on rental evictions, moratoriums on utility shutoffs. So I've been favorably surprised that all of those things were part of the conversation nationally pretty early on, and nobody needed me to jump up and down and say, hey, wait a minute, think about this. But it definitely was kind of a surreal experience in the first couple of weeks after people really started taking the pandemic risk seriously in the U.S. I did feel a little bit like, hey, wait a minute, didn't I already live through this once? And kind of had to remind myself, oh no, last time was just to my imagination, this time it's actually happening.
Very interesting. Thank you. And of course, in 1918, we had a big flu outbreak. How much can we learn from that to apply to this current situation? How much did that influence your previous work with pandemics?
So one of the things that did make me more prepared to deal with the current pandemic and to think about it is that I did have the opportunity 13 years ago to look at a lot of what was done well and poorly in 1918. And unfortunately, one of the key lessons from 1918 was the importance of early action, which we in this country didn't really get too well. In 1918, cities that acted early, so one of the prime examples people talk about is St. Louis, had much less severe experiences and fewer deaths overall than cities that waited even just 2 or 3 weeks to act, like Philadelphia. So I believe that St. Louis shut down literally just 2 days after observing their first local cases of influenza, not even their first local deaths. And so we can see that play out now internationally with some of the countries that did take early action, such as South Korea or New Zealand, having much less severe outcomes in terms of number of deaths or number of cases per capita than we are having in the U.S. And just recently, some of the news that broke about the so-called Red Dawn discussion group, a kind of informal group of health experts who were talking about the pandemic early on, I believe they were recommending local shutdowns maybe after the first death due to coronavirus in a given area. And that's already significantly later than what St. Louis did, but again, well before when we started having those lockdowns domestically here in the U.S.
Okay, thank you. So why is prevention and social distancing still critical, even now as we're past peak in some places or arguably close to peak in others? Why is it still important to have those preventive measures and the social distancing in place?
Good question. Again, back in 1918, we saw that places that relaxed their restrictions too soon saw a second peak. For example, I think Denver relaxed their restrictions initially after about 6 weeks, and their second peak of infection was actually higher than their first one. The first peak was kind of truncated when they started putting restrictions in place, but the pandemic came roaring back after the restrictions were eased. So if we take that approach and start relaxing restrictions too soon in the U.S., we will end up having suffered a lot of the same economic damage that would be caused by a longer shutdown, high rates of unemployment, high rates of business closure, all of those hardships, without really getting very much long-term reduction in health effects due to the shutdown. So one lesson from 1918 was that 1 month was almost uniformly too short to make much of a difference in long-term spread, and a 2-month shutdown seemed to be more effective. Some places were shut down quite a bit longer than 2 months. And on the one hand, the coronavirus is obviously a completely different bug than influenza, and we live in a different world than 1918. So there's no reason to believe that our experience will be exactly the same as what people experienced in 1918. However, given my background, for instance, in nuclear risk analysis, I am very used to dealing with sparse data. So for me, having a small number of historical examples from 1918 is way better than having no historical examples to go from. and we should try to learn and benefit from the experience in 1918. Moreover, if anything, coronavirus seems to have a slightly longer incubation period than the flu and a much higher rate of asymptomatic transmission. And that means that, if anything, we may need longer shutdowns than what was needed in 1918. For example, if you get the flu, usually within a few hours of becoming sick, you feel so terrible that you're just home in bed and not out and about spreading the disease very much. With the number of asymptomatic or very mild coronavirus cases, people can be out and about spreading the coronavirus for several days easily. And so this suggests that, if anything, we may need even a little bit longer shutdown, and there's no reason to believe that shutdowns very much shorter than 2 months will be effective at significantly interrupting the chain of transmission. It may damp down the transmission for a period of time and look like things have peaked, but if it doesn't get down to low enough levels, it can come back very easily.
Thank you. We certainly see a lot of different approaches being taken by different states, some voluntary, some required social distancing. So from a risk analysis perspective, do you think voluntary measures are enough, or do governments need to continue to take or implement stronger measures, and why?
So obviously this is something where there are big differences of opinion and differences of value judgments as well. And, some very knowledgeable risk analysts who I respect have been asking whether, voluntary measures are good enough. In my personal opinion, I think there are good reasons to believe that voluntary measures are unlikely to be effective against a disease that is as contagious as the coronavirus. If we were fighting a disease that was significantly less contagious, then yes, voluntary measures might be adequate. But there are two reasons why I think voluntary measures are problematic. One is voluntary measures may not be adopted by a large enough number of people. So, for example, everybody knows that teenagers tend to be risk takers and think they're invulnerable. So we saw the examples of all the kids on the beach at spring break, for instance. And even, beyond young people, there are always a certain fraction of people that are naturally more risk-taking or think of themselves as rebels and don't want to comply with recommendations. It's also really difficult to maintain voluntary measures for a long enough period of time. Anybody who has tried to diet, for instance, knows that you may be really motivated for a week or two, and after a couple of weeks, you either go off your diet or you think, oh, I deserve a break, I'm going to have chocolate cake today, and it's hard to maintain that on a voluntary basis for a long period of time. Again, there is some historical precedent to help evaluate those kinds of things. In 1918, the Army was well aware that influenza was a significant risk to military readiness and preparedness and whatever. So some Army camps did attempt to implement precautions to prevent the introduction of infection to the camp. Others really did not. Kinds of protections were, for instance, forbidding troops from going into the local town on the weekend, things like that. But it turns out that those Army camps that adopted precautions typically had no less mortality than camps that took no precautions at all, because they tended not to be enforced strictly. So if a few people went into town on the weekend and didn't act too wild and crazy while they were there, their commanding officers tended to overlook it and think, okay, that's just a thing that soldiers do. And by then, if they brought the virus back, further precautions were kind of useless after that point. Similarly, during the H1N1 outbreak in 2009, which of course was a lot less severe than the 1918 flu or the current coronavirus, Mexico City was urging people to wear masks on public transit, on crowded subways or buses or whatever, and even distributed free masks. But some of the recent news coverage that went back to look at those historic examples suggested that mask usage peaked at only about 65% of transit riders, and by 10 days later, only 10% of people were still wearing masks. So again, this kind of reinforces the idea that it's just really difficult to maintain voluntary precautions. And one illustration of why that is problematic, as I said, with voluntary measures like dieting, almost everybody feels like occasionally they deserve a break. So let's just say that I decide to get my hair cut. And since I'm older, I'm 64, and since the hair salons are closed locally, I might ask my hairdresser to come to my house to cut my hair. It's less risky than going out. So that sounds very innocuous. I'm an older woman. I'm staying home. One person outside my household is coming into my house to cut my hair. But let's say that the hairdresser has her own exception that she makes. On the weekend, she goes to stay with her boyfriend instead of staying at her own apartment. Again, only one little exception. Now let's say that the boyfriend's roommate attended a poker party the week before with a few close friends. So one more little exception. And now I, as an older woman, attempting to be extremely cautious and having my hair cut in the privacy of my own home, I'm now potentially connected epidemiologically to my hairdresser's boyfriend's roommate's poker partners. And one of those poker partners might not have been practicing social distancing at all. So one of the benefits of mandatory precautions is it reduces the amount of damage that non-voluntary compliance or non-compliance can cause. So there's always going to be some people who get together to play poker during the pandemic or whatever, but they might do less damage if they do it in the privacy of somebody's home than if the bars are open and they're taking their poker night out to the bars. So again, I do realize that there's, value judgments and differences of opinion, but personally, I think the evidence supports that voluntary measures are unlikely to be effective enough.
Thank you. The next question, one thing that I've always really respected in your work is how deeply you think about uncertainty when doing a risk analysis. And what do you see as some of the biggest sources of uncertainty as we look at the future risks associated with this pandemic, looking ahead from where we are now?
One big source of uncertainty in my mind, and I think in everybody's minds, is what will happen as states do begin to reopen their economies. Hopefully, most places will do that gradually with extensive monitoring in place, so that as each new measure is taken, you might wait a couple of weeks to see whether there is an uptick in cases and whether that measure was acceptable or whether it increased the risk by too much and led to exponential spread again. I also think there's some very interesting thinking about which parts of the economy you should be opening. For example, what is the multiplier effect on GDP? How much impact does a certain sector have on the economy? And how much physical contact is required to operate in that sector safely. So I think there will be some very interesting learning experiences as people go through that process in different parts of the country. One thing that I worry about a little bit is that the discrepancies we've seen between different states and regions may significantly slow the reopening process for the country as a whole. And I realize we're in a federal system and public health authority really is vested in state and local government, not federally. But if you have differing regions that have taken very different levels of precaution and therefore have differing levels of virus circulating in the population, some things we might want to do as we are reopening the economy, such as sending students back to college and universities, may be really impractical. Regions that have damped down their level of transmission to much lower levels may be really reluctant to accept incoming college students from other parts of the country or other parts of the world that may bring higher rates of transmission with them. So I think that will be a very interesting thing to see how it unfolds.
Given the uncertainty then as we look forward, why is a probabilistic approach and more of a probabilistic systems analysis approach important when we think about risk in this setting?
Until now, in the early phases of the pandemic response, I actually think that most of the response so far really did not require a lot of sophisticated probabilistic thinking or probabilistic modeling. The data about what was happening and what needed to be done was reasonably clear. There's obviously a lot of debates about the predictions from some of the epidemiological models that were done and whether some of the assumptions were unrealistic, et cetera. But I don't think we really at that stage needed sophisticated probabilistic modeling layered on top of those epidemiological models to know that realistically, regardless of the uncertainty about the model results, we should be taking some significant action. However, as we begin reopening, I think we will be in a very different situation where more sophisticated modeling will be very useful. And that's a place actually where our better capabilities of data collection and data analysis than in 1918 will really be a big advantage. So if you think about it, in the early stages, linear growth and exponential growth look almost identical. If you are in the very early stages of exponential growth, it still looks pretty much like a straight line. So as we are taking measures to reopen parts of the economy, we will want to be looking for signs of possible exponential growth long before there might be statistically significant evidence of exponential growth in the number of cases. So that if some particular measure that we took leads to exponential growth in cases, we want to be able to undo that measure as soon as possible before the number of cases becomes too large. And with traditional statistical significance, that might be quite a ways downstream. So that problem is actually ideally suited to Bayesian analysis. For example, we might want to say, gee, if there's even a 30 or 40% chance that the data we're seeing is caused by exponential growth, then even if we don't want to reverse whatever reopening measure we just took, we might at a minimum want to delay further measures until we know for sure whether that previous measure was overly risky. And interestingly, that's actually very closely related to an engineering problem that I worked on many years ago, back in the 1990s. And at that time, I was motivated by the challenge of being able to detect aging in the form of increasing component failure rates in nuclear power plants or other engineered systems. So it's interesting to me that my work back then may be relevant today in a totally different context. And of course, some things have changed a lot since then. Back in the 1990s, a lot of the work that I did with my student then was focused on identifying so-called natural conjugate prior distributions to facilitate the computation and make it more computationally tractable, less computing time needed to answer the question by making some sort of clever or convenient assumptions. Today, of course, computation is now so cheap that the advantage of having a natural conjugate prior distribution is really no longer needed. We can just perform the required computations by brute force, throwing a lot of computing power at the problem, and not have the need for so many simplifying assumptions. But still, it was very interesting to me that the problem of detecting early on whether things are starting to get worse seems to be a common thread across many areas of risk, whether you think about nuclear power plants or the pandemic or climate change or lots of other areas, that if you're trying to prevent a catastrophic event, you would really like to be attuned to early warning signs about whether things are getting worse, and that really does require, I think, a probabilistic approach.
Great, thank you. And it is interesting how work we have done a number of years ago is still quite relevant to this. I remember in grad school reading a lot of that work that you were doing on that problem, and I agree, it seems like it could be quite relevant to trying to detect increases early on. Well, it has been a pleasure and an honor to have some time to talk with you, Vicki. Thank you very much. We appreciate you offering your perspective and everything else that you've done for the Society for Risk Analysis.
Well, I appreciate the opportunity to share a little bit of what I've learned about this topic. It's certainly important right now, so thank you for publicizing this.
Thank you for joining COVID Conversations on Risk, a special edition of Let's Talk Risk. Visit SRA.org for more information on the topics discussed in this episode and for more studies found in Risk Analysis, an international journal.